Hi, this is Dr. Karan from Dr. PK Live. I wanted to post this small video about aspirin and its uses. It's commonly used medications. People got to know when to use or when not to use it. Aspirin is acetylsalicylic acid used in low dose, which is 81 milligram, or full dose, which is 325 milligram, for different therapeutic purposes, primarily because of its antiplatelet, anti-inflammatory, and analgesic properties. So this is a breakdown of its indication. Aspirin, baby aspirin is 81 milligram. It's called low dose aspirin. Sometimes it's enteric coated, sometimes it's not. As for the therapeutic effect is concerned, there's no difference, but enteric coated aspirin may reduce some irritation. So it's personal preference. Number one, 81 milligram is mainly used for antiplatelet, basically blood thinning effects to reduce the risk of cardiovascular events. For example, secondary prevention of heart attack or ischemic stroke or TIA, transient ischemic attack, or after coronary artery stent placement, after bypass surgery, coronary bypass surgery, or peripheral arterial disease. Also, primary prevention is indicated in high risk individual, typically men or women between age 40 to 70 who have increased cardiovascular risk and low bleeding risk. For example, somebody who is 55-year-old male with diabetes, hypertension, hyperlipidemia, smoking history can benefit from 81 milligram of aspirin, provided that person does not have history of peptic ulcer, gastric ulcer, duodenal ulcer, or any bleeding problem. It is also used in atrial fibrillation in low-risk patients and those who are unable to take typical anticoagulant medication like Xarelto and Eliquis. Now, when is 325 full dose aspirin indicated? Usually, it's used as anti-inflammatory, analgesics, and antipyretic effect, and also for a stronger antiplatelet activity. For example, when there's acute coronary syndrome, somebody is having heart attack, it is used as initial management of suspected myocardial infarction. We usually give patient one tablet immediately. If you're suspecting that patient is having heart attack, or somebody who has heart attack, then that patient gets 325 milligram, not 81 milligram. For a stroke prevention treatment, for acute ischemic stroke, and the initial dose is 325 milligram of aspirin. Somebody who has vascular procedures, sometimes that patient also gets a short course of high dose of aspirin, like somebody after stenting of the coronary artery disease or carotid artery surgery because of blockage in carotid arteries. Sometimes we also use for arthritis and rheumatic fever if there is a less risk of GI bleeding. Kawasaki disease is a disease in pediatric population. High dose of aspirin is also used. Somebody who has a high level of platelets in their blood, called essential thrombocythemia or polycythemia vera, and aspirin is used to prevent clotting as an antiplatelet agent to prevent clotting formation, because those patients have too much of platelets in their blood circulation and they are the risk of heart attack and stroke. Important thing is to remember that aspirin